my great pleasure to introduce Dr. Ravikannan. He's a well-distinguished oncologist who had been practicing in Chennai. And after that, he has moved to Kacha Cancer Care Center at the Northeast Assam. He has made remarkable contributions to healthcare. He has been very much recognized with the prestigious honors such as the Padma Shri and the Ramon Magsaysay awards. And Dr. Ravikannan has dedicated his life to improving healthcare in one of the most challenging regions of India, that is Kachar in the Northeast. It is in a landscape defined by poor resources and limited access to advanced medical facilities. He has worked tirelessly to deliver high quality treatment and care. His vision for healthcare is deeply rooted in community well-being, and his approach goes far beyond treating disease. He seeks to address the need of the whole person. A man of humility and passion, Dr. Ravikannan's journey is a source of inspiration to all of us. His commitment to community health, even in resource-constrained settings, speaks to his belief that healthcare should be more both accessible and more compassionate. So now I just join with all of us in welcoming Dr. Ravikannan for this session. So over to you, sir.
Thank you, Dr. Niraimati. I hate to utter your comments about what I'm going to speak. I just saw, that I'm going to be speaking on integrated healthcare, bridging gaps for better care and greater happiness. Unfortunately, I come with a problem statement. I'm going through a midlife crisis, and I want to share with all of you trying to find solutions to address my crisis. So, we have been working in the Northeast for a long time now, and we've had our set of problems. And over the years, we have put in place several measures. Most of it pretty organic, knee-jerk actually. Some of them worked, some of them did not work, some of them were downright foolish. But then over the last several years, we have grown from a small 20-bed, 23-staff hospital to nearly 150 beds with about 480 staff, spread over 5 campuses in the region, in Kachar, in Karimganj, in Hailakandi, in Dima Hasao. And we treat much larger numbers of patients, and we have a very large community. Overall, this can be argued, this can be audited, but we think some good has happened in the process. Many people have gotten treated, some of them cured, but families have gone back, happier and feeling well cared for. But what has been bothering many of us in the organization over the last year and a half, more acutely, more deeply over the last few months is, see, if all of us together, if you look at the core 30, 40 people in the organization, together, each of us has contributed more than a decade and a half, and collectively, all the time that we have spent in the organization is more than 500, 600 human years. Together, we have put in so many years worth of time. And all this growth and expansion has happened. But now we have begun to question that whether we are sustainable in the area that we are operating. Are we sustainable? And if we are sustainable, are we reproducible? And believe me, it bothers me tremendously to confess that we have come to the conclusion that we are not sustainable in the current avatar that we are in. This is very painful, but that is the truth. Because see, the organization has done a lot because it is passion driven. Passion from a few of us, 20, 30, 40 of us, driven to bulldoze our way to make all of this happen. And so, what happens if you remove the passion from the story? Are you still sustainable? And unfortunately, I think we are not sustainable if we are to remove the passion from this story. And so, we are beginning to realize. So, so we start think every almost every day we have this conversation about what is it that will make us sustainable. So when we break down sustainability, there is sustainability in terms of human resources, sustainability in terms of social relevance, sustainable in an environmentally conscious way, and of course, economic sustainability. And what we have come to realize is, though it may sound to be the hardest, actually, economic sustainability is probably the easiest of all of these to achieve. We just need a couple of smart people who will sit and write projects and use our data, highlight the good that is happening, highlight the services, and approach different funding agencies. If we approach 10 of them, probably one or two of them will open up their purses to support what all that we're doing. But the rest of it, to sustain human resources, to sustain our initiatives socially and in an environmentally conscious and friendly manner is a much different ball game. And if you look at all the measures that we have, so if you look at the hospital and dismember the hospital into different sectors, there is doctor, there are nursing technicians, a whole lot of services happen in the hospital. And if if you look at them, what I think is sustainable is the way we have been managing our nursing services. So when I joined in 2007, we had only 6 nurses, and none of them was formally trained. They were all DAI. They had been trained to deliver babies in the homes of the community, and 6 of them were functioning as our nurses. My center forward in the theater was not even a DAI. She was a girl who had gone to a nursing home for an appendectomy. She liked what was happening in the hospital and she stayed on there. And the surgeon of that hospital, who's a very well respected surgeon in the region, he referred her to me saying that this is a good girl and she'll be useful. And she was my center forward in the theater for many years. Unfortunately, she developed multi-drug resistant tuberculosis. She had to have treatment, and after treatment, she lost that desire to work in the hospital. But the fact is, we had only 6 nurses and we were craving for qualified nurses. When the first of the ANMs joined, we were jubilant. And when the first GNM joined, we actually celebrated. What happened was, sometime down the line, government issued a notice seeking applications for government postings for nurses. At that time, we had about 35 nurses in the organization, and overnight, 25 of them resigned and walked off. Just like sparrows from the tree, they're all just disappeared. And we were left with a very small number of nurses. By then, our services had expanded. And we were very hard pressed to maintain those services when so many nurses suddenly left as a flock. And at that point, we took a decision that for statutory purposes, for nursing council, medical council purposes, there are rules, but that for every 5 patients, you must have a nurse. And so today we are 150 beds. So we need about 50 nurses to satisfy the NNC laws, to satisfy the Clinical Establishment Act. So we took a conscious decision that 50% of our nursing staff will forever remain DAI, people who we will train in-house, and they will stay. For them, they have greater responsibility, they have greater respect in their communities, they have an assured job, and they earn much better than probably 3-4 times the amount that they would earn in other nursing homes. And so they are unlikely to leave us. So this is a situation where they support us, and they in turn are supported by the organization. And the nursing services are unlikely to take a hit because of the pulls of corporate hospitals and government. But all of the, if you look at a hospital like ours, we're a 150 bed cancer hospital. We do about 600, 700 majors. So we need so many MCH surgical oncology. We need so many medical oncologists. We need so many radiation oncologists. We need pathologists. We need radiologists. We need, if you look at the organization, we will probably in an ideal environment in a city like Chennai or Trivandrum or Delhi or Mumbai, we will probably need 50, 60 well qualified people to to run the hospital in a manner that will be acceptable to the public at large. But if you actually look at it, a mastectomy or a gastrectomy can be very well performed by a trained general surgeon. Ultimately, see, when I was a resident, we didn't have so much of surgery, we didn't have so much of specialization. And in my unit, we used to do thyroidectomies, gastrectomies, mastectomies, and they may not, I don't remember we have ever audited the number of nodes and all that we didn't do. But then a general surgeon who is well trained can do all these procedures equally well. Obviously, very obviously, see, we were physicians, we were doctors, and then we became surgeons, and then we became, gastro surgeons or gynec surgeons or surgical and then we became laparoscopic GI surgeons and open GI surgeons, and then we became surgeons of the hepatobiliary tract. Then we became surgeons of the liver separately and the biliary tract and pancreas separately. Very obvious that somebody who operates only on the right nostril will be a much better surgeon than somebody who operates on the entire head and neck. But then, does it really make such a big difference to the outcome? Just that high level of super specialization, does it actually improve outcomes? There is data to say high volume centers do better than low. All that is fine, but I'm not sure that degree of specialization is important. If you look at medical oncology, so we treat about 1,000 patients or 2,000 patients with chemotherapy every year. And in order to sustain the medical oncology services in a standard way, we would probably, ideally speaking, every patient who comes into the OPD must be seen by a medical oncologist. But look at it actually, at the time, if somebody with CA breast comes, we need to give him or give her 4 cycles of AC and 4 cycles of paclitaxel with or without trastuzumab. That decision has to be made in the beginning. And then patient comes for chemotherapy. Every cycle the patient comes for what is needed. We have to make sure that the patient comes in walking, that his general condition is good, that his vital parameters are okay, pulse, blood pressure, everything is okay, that there is no toxicity, no mucositis, no fever, no cough. His lab values are good. And in some areas like the breast and oral cavity, that there is tumor shrinkage, it is not. That's all we have to do. And that is really a spinal level job. A doctor with an MBBS degree or even an alternate, somebody with an Ayush background can be trained. A good nurse or a nurse clinician can be trained to do this job. Efficient, what will happen? It will improve efficiency, it will shorten time of care, and then it will also reduce the cost. So what has happened is the fragmentation of healthcare into specialists and super specialists and ultra super specialists has actually led to a patient comes into the OPD, he will see a surgeon, then he will be referred to a medical oncologist. Medical oncologist will also refer him to a GI surgeon, and then he will be referred to a nutritionist, referred to a physiotherapist, referred to an occupational therapist, patient will be footballed around. We'll see, 15 different special. Of course, everything is justifiable, everything will improve, okay, all very good. But he will be footballed around, and at the end of it, he will also end up paying more. Sometimes they may not be able to afford this. I was talking to a senior radiologist some time ago, and he was talking of how corporate sector and private hospitals have improved the quality of care. And when I brought about this talk of the expenses involved, he says these hospitals generate wealth, and wealth creation is the responsibility of every citizen of this country. The wealth creation in terms of healthcare is fine when we have people from outside the country flocking to come here and spend their money here. But what we are doing is we are merely shifting wealth from one set of people to another set of people. And sometimes people who can ill afford to buy these drugs will go and spend everything on healthcare and get tremendously impoverished. And there is data to show that one generation is impoverished, goes because of out-of-pocket expenses. It takes 3 generations for that family to recover. And while on one hand we spend money buying expensive equipment from abroad, we also use healthcare without realizing it. We end up impoverishing a whole lot of people, which in the long run, instead of creating wealth, actually reduces the wealth of the nation. And this is something that is bothering us tremendously. Now, so as a organization, now we are wondering how is it that we are going to sustain amidst all this, there are so many specialists coming in. The remuneration required for many of these specialists is not something that we can easily afford. And now, how do we cultivate values in the so one of the things we thought is all our conversations in the organization should be about values, about what is it that we want to, how do we cultivate values in the so one of the things we thought is all our conversations in the organization should be about values, about what is it that we want to propagate as part of healthcare delivery. So if we have to have, even if we don't get 60 highly trained specialists, we will still need 10, 12, 15 specialists who will contribute to uh, taking care of patients, who will also contribute to active task shifting of shifting tasks that can be done by highly specialized people to people who are less specialized but who have the skills and who can do an equally good job, and they must be comfortable with it. See, we had a situation where we had our radiology technicians doing all the radiology CT guided lung biopsies. And then at some point of time, we had a young radiologist join us, and he was very enthusiastic, but he started doing all the biopsies. We actually compared the outcomes between the radiologist done biopsies and the technician done biopsies. No difference in complication, no difference in the tissue yield. But what happened is the radiologist stayed with us for some years and then moved on to better options. But then what happened in the process, the technicians who were very skilled suddenly lost their confidence. And now they're in a situation where they have to rebuild their confidence. So it is important that as leaders in healthcare, we realize the importance of task shifting in a bid to uh, provide more inclusive healthcare and at much lower cost without, of course, compromising on value. Anyway, so this question comes back to about building values in the organization. And very often I'm placed with the argument saying that, see, it is people who 30, 40, who spend 10, 15, 20 years in the organization, have seen the struggle, have been part of the struggle. And so that value system is inbred in them. And so, but then when younger people join, these kids have not seen what is happening, and so they don't have the same values as the oldest people. This is something that I completely disagree with. I think youngsters come with a lot of, they come with stars in their eyes. They want to, the kids born in the early part of this century are out to change the world. They believe in doing great things on this earth. So they are not the fellows who are weak on values. What happens? People who've been in the organization started as youngsters, started as bachelors, they got married, they had children of their own, their kids had to go to school, they needed a car, all perfectly valid reasons for needing more money. And so there is some conflict in needs, but this doesn't weaken their values. What is the main cause for weakening of values is the leadership of the organization. What happens? when we were small, when we were 20, 30, 40 people, when we were 50 beds, 80 beds, 100 beds, if something was not okay, we were happy to trash it because we did not have much to lose. As the organization grew bigger, as the organization started treating more patients, as more services started, we became hesitant about losing people. So if there's a doctor who, as leadership, we think very important that we cannot do without that person, we tend to start making compromises. So for some reason, if he or she defaults, doesn't come on time, does whatever we think is not appropriate, we tend to gloss over those inappropriate behaviors because we think that individual is indispensable to the organization. And so what happens? Younger people watching this happen suddenly realize there's no importance of values. That the leadership talks of core values, but actually leadership doesn't practice or promote it. And so they lose their sense of values. And to me, I think that is the most important thing that we have to guard against. As an organization, we all sat down and wrote down what is our vision, that we want to do big things, we want to rid this place of all the cancers. And so we wrote all our values as a large group, and then all of us sat in a room and wrote down what our core values are. We said our core values will revolve around compassion, will be evidence-based care. We said we want to be frugally innovative. Innovation is fine, but we want to be frugally innovative, that we want to maintain our pro-poor. See, what will happen is the concept of poverty will change. Today, 10 rupees may be considered poor. Tomorrow, 100 rupees may be considered poor. The needs of poor people will change, and so will the solutions. But then, so long as there are human beings in play, there will always be people who are marginalized. There will always be people who are at the end of the queue, who are just unable to come to the forefront because we are all human beings and these politics will be there. So there will be people who are underdogs, and as an institution, we want to be an institution that will take care of marginalized and people who are underdogs. We very strongly believe in teamwork, and we're actually grateful for all that is happening around us. And so we want to now and see. So now I've been talking to everybody around. One of the things that came to me was that these values have to be discussed all the time. When you hire new people, you have to see if they will gel with these values. In the organization, frequently we need to uphold these values. The leadership has to be seen upholding these values. The leadership must be seen discussing, all of us in different. And there are people who swear by these values, these testimonies of people who stick on. Some of my colleagues, have made these statements. Today I heard, somebody tell me this in a conversation, that so and so said that she came for a few years, and then she saw what is happening, and they stayed on for a very long time. So and so came from a corporate background and came here and saw value. So these testimonies have to be discussed. That messaging about the value system. Somebody said your website is all trash because it does not speak of your values at all. And so when you are advertising for recruitment, for filling up places, we need to, more than saying we need an MD radiology or DM medical oncologist, you have to highlight that this is what the organization's values are, and we want to hire people who fit these values. And so it is the problem statement that we are having. I'm still not very clear how to frame the problem statement for a QI process, but my problem statement is we are an organization that has been around for 25 years, that has grown in a manner with some ideology, some thoughts, but now finds itself in a position that we find unsustainable, not because of economics is one small part of the problem. Bigger problem is we are not able to hire people or retain people. We're not able to uphold the values that we actually deem necessary to have an organization like this. And that, task shifting and all of that is part of the problem. So, all of us play different roles in life at different points of time. And so, I am not sure if everybody is a physician here, but everybody in the healthcare and probably even outside, we all have opportunities to heal sickness, but we also have opportunities to heal each other's wounds, each other's injuries, each other's felt or perceived or real experiences of injustice and unfairness. We all have the opportunity to heal people around us, and we all have an opportunity to be rational. Yeah, we don't have to be great researchers or scientists, but we have an opportunity to be rational human beings who will look into uh, the 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 veracity of what is happening in front of us. And then, of course, we all have an opportunity to mentor, to teach others through what we have learned, through our own life's experiences. And then, most importantly, I think we all have the opportunity to be change makers, to catalyze things in a manner, to drive processes around us in a manner that will make the world around us a much better place. Thank you very much. But I look forward to understanding from you all how we can drive a non-government, not-for-profit, community-rooted organization forward in a sustainable manner. Thank you very much.